to the end of the year. This is the official last edition of NESHA Talks for 2025. We're excited to give you the last edition with none other than himself. That's Dr. Nelson Makemba. Doc, we have come to the end of the year. How does it feel?
Yeah, indeed. It's end of the year. I mean, it always feels like one is getting a little bit worn out. The fatigue sits in.
The energy levels.
The energy levels just goes. Yeah, so we're looking forward to the festive season.
Yeah.
And obviously this is the best time because we are taking off from our busy schedules, getting to spend time with loved ones, families and friends, and traveling and doing all the other exciting stuff outside of office environment.
Yes.
It's always an exciting time, end of the year, because there's always a lot of festivities happening. So I'm looking forward to that as well.
We are too. So before we let Doc off on holiday, we decided to speak on the last edition, which is all about innovations in cardiovascular care.
Yeah.
How important is this topic, Doc?
It's very key, and indeed it's a pertinent topic to actually talk about, because cardiovascular related diseases and events, and also individuals who we have been losing to cardiovascular related diseases, that number has gone up.
Wow.
And we are seeing it also increasingly happening in the younger population. It's something that we have over a period of time thought of being common with the senior citizens because of aging organs and having lived that long. But it's also becoming common in the younger population.
Why is that?
So also lifestyle, has played a major role. Aspects of genetics, for instance, that we have probably not understood very well over the years, and the medical fraternity is catching on, and we are getting to understand much better, and much has been done in that space of genetics. So we are actually able to precisely pick up this risk when they exist, and we can actually map out, a stratification for a patient and say the likelihood of this and that happening to you, depending on your genetic, is highly likely. So recreational drugs, for instance, cocaine, weed and all that stuff that young people tend to use, maybe excessive alcohol consumption are some of the reasons why we are seeing this kind of things happening primarily and commonly with the younger population.
But one would think the more innovations we have, the more technology we have, the less it should be. But why have we now decided to say, what are the innovative ways when it comes to cardiovascular care and treatment? Yeah,
if you look at, for instance, the genetic profiling that has been happening, probably in more advanced setup, we are still to catch on with a lot of things. They are now looking at things like high sensitive CRP, it's a C-reactive protein. They are looking at things like remnant cholesterol, for instance, SST2, GDF15. These are some of the genetic, sort of stuff that they are able to test, and with that they can sort of, with precision predict, how an individual might end up developing some of these cardiovascular diseases. And also, if you look at some of the innovations that have taken place, telemedicine, you can do things remotely. Wearable devices, some of these watches can actually tell you what
your heart rate
is,
how many steps, everything.
Yeah, definitely. And also we have, quite, advanced online platforms nowadays. I could have a patient that have a device at home, they test their sugar, and they load that sugar on an online platform. I'm able to log on, and I can actually look at the trend, and I will be able to advise my patients accordingly. So those are some of the innovations that have unfolded and have actually, allowed us in the fraternity to bring about, care with precision. For a good number of years, back in the days, we used to have, a term that we often used a lot, empirical management. In other words, I know that these groups of drugs will take care of ABC. And then we used to just give them in a blanket to say, okay, if this is the condition, once I give you these 3 drugs, I'm most likely going to, get you somewhere, where you're going to feel much better. But with this, evolving, of the medical fraternity and the technology coming in, care has now become individualized and is very precise.
Yeah.
So you don't just give a drug because it's there. You run all these tests. You are able to give the drug that will give you maximum benefit with less side effects. So that's what this evolving of medical fraternity has done to us, and we are able to care for a for patients with precision.
Yeah. Doc, you mentioned the word stratification a while ago. So linking it to that, how can the primary care helpers implement risk stratification tools just to enhance?
Yeah, if you look at for instance these wearable devices, telemedicine. If you look at some of these portable devices that patients then can use at home to monitor either be their sugar, be their cholesterol, be their pulse or their blood pressure, for instance, at different various intervals before and after they've had a meal, and collecting all that data. And then also the AI that has come in. It's very helpful as well. We have AI assist now that we can use in our practices, that enhances our ability to care for our patients. So, and we can also use them then to risk stratify an individual. It becomes so personalized that, instead of us just going by the knowledge and, treating everybody, and grouping people just, throwing a blanket over them, we now have to look at your data in your individual capacity. We look at your genomics, we look at your background in terms of your family history, then we tie it in with your lifestyle, and then we can then come out with a plan, having stratified you that is unique to you as an individual.
Lifestyle is very important, Doc. Alarmingly, you said that the younger people are also now getting, these cardiovascular diseases. But give us some of the examples. How do we prevent this, especially for the younger generation? What about the lifestyle? Maybe just our environments, etc.
Yeah, the first thing probably, just people, don't really understand how important rest is. Just getting a good sleep.
In the world of busyness. Thank you, Doc.
So we, especially as the young people, sometimes we are under pressure. You have goals, you've got a dream, you're chasing, you're up until, you're burning the midnight oil. But rest is very important. A good 6 to 8 hours of rest. Just eating a healthy, balanced diet. And I always tell patients, it doesn't have to be expensive to be balanced. Well hydration, drinking enough water. Managing those stresses, because we all have them from time to time. And I always tell people, you don't need to break down before you go see a psychologist. Sometimes you can just go see a psychologist routinely. Sit down with a psychologist, start talking, you realize there might be issues there that you didn't even realize they are there. And then deal with those before they blow up in your face. Minimizing, alcohol consumption, very important. Staying away from recreational drugs. There's one thing that we always say: if you love your heart, don't smoke. Whatever is smoking, don't touch it. It's a cigarette, don't touch it. If it's a herbal, don't touch it. Smoking is never a good idea for your cardiovascular health. Making sure that you cut out on this polyunsaturated fat, cutting down on fast food. You have to enjoy the finer things of life, but everything in moderation. Maintaining a desirable weight. If you're able to slot in any exercise, exercise. That comes a long way. And obviously going to your healthcare provider, be it your general practitioner or your cardiologist or your physician, just to follow up and make sure that you are still in good health.
Doc, there's so many other questions that we can ask, but I think just to wrap things up, anything that is quite critical and essential for those watching right now to still bear in mind and be mindful of?
Yeah, really when it comes to cardiovascular health, I think the message really is that anybody can come up with a cardiovascular issue, particularly from the age of 20 upward.
That's still young.
To think that you are young and it won't happen to you, that's living in a world that has gone past, So the idea really is make sure that you check yourself out all the time. We are being caught out by young people that just the person collapsed, by the time the ambulance arrived, it was too late. And then in retrospect, studies are done, maybe an autopsy is done, and then all things are found, So really, everybody need to be, very, careful and on an outlook. They need to go and have themselves evaluated and just make sure that you're in a good space when it comes to your heart and your circulatory system, your sugars and cholesterol, because all of this together, they end up, affecting your system, making sure your kidneys are functioning very well.
For the festive season, let's also be extra careful. Doc, it's been a whole 12 episodes. Thank you so much.
Yeah, no, definitely. And we look forward to next year.
Yes, we are. So from us here at NESHA Medical Practice, thank you for joining every single episode. We'll be back in 2026. Until then, it is Merry Christmas and Happy New Year.